On behalf of Incubation, we would like to pay respect to the traditional custodians of the land we are gathering tonight, and to all the Aboriginal and Torres Strait Islanders peoples, the first Australians, whose cultures are among the oldest living culture in human history. I pay respect to the elders, for they hold the memories, the traditions, the culture and hopes of Aboriginal and Torres Strait Islander peoples across the nations. I also extend my respect to Aboriginal and Torres Strait Islander colleagues who are here tonight. Ladies and gentlemen, I would give the floor to Angie and Karen.
Thank you. So I'm Angie, and this is my colleague Karen. Nancy and Ritia couldn't make it tonight. They were supposed to, but they unfortunately couldn't. Thank you all for coming after a big long day at work. It's very good of so many of you to turn up at this time of day. And thank you especially to the primary health work for making this event happen and getting everybody here and feeding everybody and doing all the other bits and bobs with registration and certificates. So this evening, I'll just give a little bit of a chat about our team and what we're currently doing at the moment. And we'll just talk about why vaccines are so important and what it takes to be a vaccine provider, you know, how you guys all became vaccine service providers and the hoops that you have to jump through. And then we'll talk about the nitty-gritty, managing your vaccines and vaccine fridges. And then we'll go through experience of cold chain breach and packing a cooler, and I'll talk about the different resources that are available as well. I'll try and present first and do questions at the end if that's okay, but if anyone's got any real burning questions, then you can chip in. The session has been recorded, so we probably don't want too many conversations, because for the people who've got to download it in a couple of weeks' time, they'll probably just make the recording very long. Oh yes, and we've got a microphone as well if you ask any questions. And we've brought some coolers along with us, and they've already been iced and bubble wrap, and we've got empty vaccine boxes in there. So we thought we could do, if people wanted to come up, and we can put the eskies on the table and just have a go at like a practical session at packing the eskies, or just have a look at how they've been packed. I can hear some voices actually.
Well, this has got Teams on the computer.
All right. So for the past couple of years, things have been a lot of changes regarding cold chain and within our team. We work quite closely with a Queensland Health immunisation programme, and there's been quite a few working groups that we've been lucky enough to be a part of, and we've been super users. So we've had a lot of input with QIP recently, and we know the staff there very well now and work quite closely with them, which is great because we are very well informed now that we've got such a good relationship. And one of the things that came out a couple of years, only 12 months ago, is it's called VMS, Vaccine Management System. And that's sort of like a software package, a portal, and it's how we communicate with QIP. And that includes managing cold chain breaches, your ordering, and the links to toll. It's a whole new system, but it's very user friendly for us now that we've got used to it. But that's could be one of the reasons why your cold chain breaches might have taken a while to manage recently, because we had to get used to this new system. And then we've been part of another working group for the new vaccine management protocol templates that are out. Hopefully you should all have seen that. And I will talk a little bit more about the vaccine management protocols in a little while, but that's we've worked quite closely with QIP with that. And then the latest thing, I don't know if you're all aware, but pharmacies are going to be able to give NIP vaccines starting from January 2024 from age 5 years and up. It looks at the moment like it might just be adolescent vaccines to start off with, but that may be reduced to children from 5 years of age, and in the future it may be that they're vaccinating young babies. So it's all sort of changing at the moment. They're what's the EPA? Their Extended Practice Authority has just been written at the moment, so we're not quite sure what they're going to be allowed to do and not allowed to do. I think that comes out at the end of this month actually. And that's Karen's job at the moment. Karen's just sat in a new position, and she's supporting all the pharmacies and their vaccine management protocols. And that's why we've got our new member of staff, Ritia, because she's doing Karen's position while Karen does the short-term contract. And the big thing that also changed this year is thermostability data. So all the vaccines have their own levels of what their pharmaceutical companies say, whether they can go to 12 degrees, 15 degrees or whatever. And we've always worked with thermostability data before, but what they've done now is they've made it cumulative. So for every cold chain breach that you have, we have to calculate what temperature the vaccine got to and how long it stayed at that temperature for. So if you've had 4 cold chain breaches within a few months and all the vaccines have perhaps been stored in different ESCIs, so stored at different temperatures, we have to know exactly which vaccines were stored at which temperature and for how long for. And then we have to consider all the previous vaccines cold chain breaches as well. I can still hear a bit of somebody, I don't know where it's coming from. So it can take a really long time to work out, but the positive thing from that is that you may notice that we're not discarding as many vaccines as we used to, like particularly like if a vaccine got to 15 degrees for a second time, we used to just make you discard your whole fridge, but we don't do that anymore. We just have to ask a lot more information from you guys. So that's sometimes a couple of the vaccines we have to go straight to the manufacturer as well, and they've got like a tool that we have to use to work out the thermostability of those vaccines. So it's not as simple as it used to be. So just bear with us if you've had a bit of a complicated breach or a couple of repetitive breaches. It's a lot of working out and quite time consuming, especially if we have a few on the go at the same time. I won't talk about Shingrix and Memby because it's a cold chain presentation tonight, but if you've got any questions at the end, because obviously Shingrix is coming onto the schedule in just a few days, and there's changes to meningococcal B next year, which will be starting with the year 10 adolescent schedule to begin with, and there will be other changes. A big part of our job is trying to health promotion, trying to work out how we can get vaccination rates up, a lot of vaccination fatigue post-COVID. And then our ongoing work with the flu vaccine, the rates have been low, particularly since COVID, and we encourage you all to get your patients vaccinated for flu. So that's just some of the things we do, but not all of them. This is data from Cairns HHS from 2022 to up to date. So I just wanted to give you an idea of what our figures look like locally. And for our Indigenous population, the 1 and 2 year olds, it's pretty low. It's down in the 80s. And to obtain herd immunity, you want to be at 95%. By 5 years old, the Indigenous population do tend to be caught up, which is great. But then you've got these little babies that are very vulnerable and not fully vaccinated. And it's low in the non-Indigenous population. And for all children in Cairns HHS, where by 5 years old, we're looking at 93.6%, which are only 92 at 1 year old and 90% at for 2 year olds. And ideally, we need to be at that 95% mark to get herd immunity. So a big part of our job is trying to find out how we can improve this. This is just a graph taken from Urban Cairns. This is a project that Nancy's working on actually, but it just the yellow line. This is from 2017 to 2023, but you can see by that yellow line is the non-Indigenous population, and there's a definite curve down there, which isn't great. And yeah, we're just, however we can improve that, we can, and that's you guys out there. If you can find ways to talk to your clients, do your recalls, reminders, follow up. But that is very much Urban Cairns, this, and as I said, it's a project that Nancy's working on, but I just wanted to show you how that's going down, and it's not what we want. We want it to be going up and aiming around 95%.
Do those figures include the actual NIP only or the additionals for the Indigenous?
That will include, Nancy did this, so I'm not sure, definitely just NIP. I would imagine she would have included the additional because it's an Indigenous project that she's working on. So I'm pretty sure she would have done, but I can't be 100%. And then just to let you know, because we're here to talk about cold chain. So last year we managed 87 cold chain breaches, and year to date we're on 65 cold chain breaches at the moment. This is for Cairns HHS, and last year we spoke to people about 116 vaccine administration errors, And to date, we're at 110. And that's only the ones that we hear about or we find out about when we're doing overdue notices. And we really encourage you to call us with vaccine errors. I know some people feel a bit uncomfortable about it, but it's a good opportunity to sort of repair the error that's been made, we'll give the correct vaccine that's needed, and just a bit of education. If you've got a new staff member who has given Zostavax instead of a varicella, then that's, you know, that needs to be discussed and not happen again. So and also the adverse event forms are for vaccine administration errors as well, and QIP are asking that anyone who's made a vaccine error fill out adverse event form for vaccine errors as well, and that is on the website. I think I've got a clip of that later.
If there's an adverse a vaccine error, and you're going to formally send it to you?
No, it goes to, there's an email address on the form. It's a form online, and there's an email, it's a Knox CDIS email address. It's on the form. So yeah. Yeah, it's on the form. There's an email address there. All right. So vaccination, along with sanitation and clean drinking water, are public health interventions that are undeniably responsible for improved health outcomes globally. So it's so important that your vaccines are well looked after. And you can see from the little diagram at the top, there's several pictures to that, but I just showed the one that shows where most of the people are vaccinated. So the yellow people are all the people that are vaccinated. The red person is a person that's got an infectious vaccine preventable disease, and the blue people are people that can't be vaccinated for whatever reason, immunocompromised or by choice or whatever. And you can see that if there's a big spread of disease, if the vast majority of the population are vaccinated, you protect everyone else around you. And that's what we call herd immunity. And to obtain herd immunity, we need to be at 95%. And the vaccines that we're giving have to be potent. That's why we're always banging on about vaccine management so much. And if you protect in the individual, you're protecting the community as well. Just a little bit about vaccines before we start talking about cold chain. So vaccines are different from a lot of healthcare in that vaccines are designed to prevent disease rather than treat it. So we're coming at a bit of a different angle with vaccines. And they do this by priming your immune system to recognize specific bacteria, viruses, and pathogens. And this memory can last for years with vaccines. That's why vaccines are so good. And they're so effective at stopping people from getting sick. Prevention is better than cure. So vaccines are expensive. They're complex to make. They're all the research that goes into them beforehand, millions of pounds and millions of dollars. So it's big money behind bringing a vaccine onto the market. And then once it's on the market, they are expensive to purchase. And vaccines, they're biological rather than chemical. So this is what makes them less stable. So that's why we have to protect them so well by keeping them at a certain temperature. Vaccines are made up of whole bacterium or viruses or parts of them, or sometimes just a protein or sugar. The active components are called antigens, and this is what triggers the immune system. But a lot of vaccines have adjuvants in them, and these boost the immune system. They kind of stir up the immune system, and it's often the adjuvants that cause the injection site reaction rather than the actual vaccine itself. So a lot of work goes into vaccines. They're very expensive, but the reason that we have vaccines is to prevent vaccine preventable diseases. So we're very lucky in Australia because we have this amazing vaccination program that we don't see a lot of these vaccine preventable diseases. But if you talk to parents and grandparents and great grandparents, they would have seen a lot of children and people in society with some pretty awful diseases that are now vaccine preventable. And so it's a bit of a hard sell for people who are vaccine hesitant to sell a vaccine when people actually think that they're protected by everybody else as well. But if we're not reaching that 95% target, then we're not protecting everybody else. So we don't see polio anymore, and that's because everyone's vaccinated, and it's very rare that there's very little polio in the world. But unfortunately, we do see meningococcal. We had an outbreak at a school last year, and there has been a couple of deaths of teenagers in Queensland from meningococcal this year. We're very fortunate that we have meningococcal ACWY for the adolescents at the moment, and next year meningococcal B is going to be available for the adolescents as well, and hopefully meningococcal B will be available for all children under 2 next year, but we're just watching this space to see. At the moment it's the Aboriginal and Torres Strait Islander children that's available. So just these are the reasons why we vaccinate, and it's just not in our society every day, so it's a bit of a hard sell for you guys sometimes to encourage people to get their vaccines done. All right. So you're the guys that do the work. Practice nurses particularly play an essential role in providing the Queensland immunisation programme. We really value what you do, because we know that you're not just out there giving vaccines. Karen and I have both been practice nurses. There's a lot of other jobs that you have to do, and we place such emphasis on your vaccines being stored correctly and administered correctly, and to do your catch-up schedules. But we appreciate, you know, you're running in and out doing dressings and ECGs and everything else that you do. So you do play a really essential role in this funded programme. But the programme, it is a government funded programme. So those vaccines that are in your vaccine fridge do belong to the Queensland government. And in order to do that, you have to comply with protocols and procedures. These are put in place by Queensland Immunisation Programme, and it's QIP that regulate these, but we oversee that. So that's why we're the main voice that you speak to, and we support that regulation. If you are authorised to provide the vaccines, QIP do expect a high degree of compliance and management. And they do have quite strict criteria that they ensure that we make sure that you guys are all working underneath that programme. And just looking, I've just put the schedule there because we know how many vaccines you have in your fridge. There's an awful lot. So vaccine management is important, and as health professionals, you have a responsibility to ensure that all your clients receive effective health products, and this includes vaccines that have been stored correctly and not adversely affected by heat or cold. And if you have good vaccine management, that precludes the need to revaccinate clients who may, under circumstances of poor vaccine management, receive an ineffective vaccine. There's nothing worse than having to call up somebody and explain that the vaccines haven't been stored correctly and revaccinating that child. It's again, it's another hard sell to and parents end up losing faith in your service as well then. So and you don't want that to happen. You want, you know, to support your community and ensure that they're receiving potent vaccines. So you would all have gone through a process to become a vaccine service provider, and one of the main things is that you have to have a purpose-built vaccination fridge. You can't have a bar fridge anymore, or a non-purpose-built fridge. Even in the event of a cold chain breach, your vaccines can't go in any other fridge other than a purpose-built fridge. All vaccine fridges should have data loggers now, as per Strifer 5, the Strifer 5 that came out a few years ago. You're definitely supposed to have a data logger and know how to use it. Before you would have been able to become a provider, you would have to provide a temperature documentation, and that's the same if you purchase a new vaccine fridge. You do need 48 hours of monitoring, or if you move facilities or anything and you have to move your fridge. You have to have a vaccine management protocol. Always have a copy of Strifer 5, keep it near your fridge, and make sure you've got your fridge manufacturer's instruction manual, ideally kept near your fridge or on your desktop, because you need to know the functions of your fridge, and often it's just left to that one person. But everybody needs to know who's dealing with the fridge, how to use the fridge. Same with the data logger as well. And ensure that all your staff are educated in vaccine management. And that doesn't have to just be clinical staff, it can be non-clinical, especially in the smaller GP practices. You need to make sure that everybody's on board, and it's not when that one person that does everything goes on leave that everything falls apart. And your backup equipment is very important as well. Your SGIs, your min-max thermometers, ice packs, bubble wrap and logbooks. So you will have gone through all this to be a VSP, and hopefully you've continued with all this since becoming a vaccine service provider. Can't emphasize enough how important the national vaccine storage guidelines are. It's throughout the whole of Australia. It's kind of our gold standard that we all work towards. So, and it's got some really handy stuff about in checklists for managing power outages, checklists for packing SGs. It's got an audit tool in the back. So please read your Strive for 5. The vaccine management protocol, everyone would have one, but they may need updating. It's important that they have all these: vaccine ordering, delivery, temperature monitoring, power failure procedure, cold chain, documentation, equipment maintenance, transporting of vaccines off-site if you need to, and staff education. So all these things need to be in your vaccine management protocol, but hopefully, if you've got the new template from QUIP, then everything that I've just talked about should be in that protocol. And all the new pharmacies that are coming on board as vaccine service providers are not allowed to order vaccines without this vaccine management protocol. So it's a template, you just fill in the blanks, you personalise it to your own clinic, and then it's got all the details on who to contact, the order in which you go, follow it through in the event of a cold chain breach. So QUIP haven't said it, but I have a feeling that eventually they'll want all vaccine service providers to have this templated vaccine management protocol. And it's perfect because it's written by QUIP, so it's telling you exactly what they expect. And ideally, your vaccine management protocol should now be updated annually. And they will ensure that this is kept up to date online as well. We can send you out the most recent. Whenever you want to update your VMP, just let us know and we'll email you the latest copy, because if there's any changes to contact details or any changes to how procedures are what they expect, it'll be in this vaccine management protocol. So as you all need to start renewing your vaccine management protocols, just give us an email and we can send this to you. And every time you have a cold chain breach, we always ask for a copy of your VMP as well. And that's a good time for us to say that fill this one out. And also, if your VMP is not up to date, you can't order vaccines as well. So try and keep on top of that with all your kind of other annual stuff that you do. Ideally, you should have something similar to this next to your vaccine fridge. So it just gives a little summary of what to do in the event of a cold chain breach, just in case there's someone on duty that's not normally looks after the vaccines or that familiar, but ideally everybody should be. And it's got the contact details, and you can put our details and you can put QUIP's details on there. So these are from the National Immunisation Programme, so you can download them, or we can actually send you some of those. So it's important to have those contact details near your fridge. And then everyone should have the red stickers. There should be one on your socket so that everyone knows not to unplug the fridge. So we do have, in the past, we've had cleaners who've unplugged fridges to plug their vacuum cleaners in and caused cold chain breaches, or maintenance people. You need to have on your fridge a sign so people know not to open the door and just stand there with the door open. So please make sure we can get you these stickers, or you can order them from QUIP.
In one of my top drawers.
Boys, just have a sip of water. So if you're following the guidelines, hopefully there won't be any errors. And errors can lead to revaccination, significant waste, or ineffective vaccines. And the big thing that we're trying to do here is we want to protect your community. And a lot of us, your family members will come to that practice, and your friends. So you just want to make sure that you're giving everyone potent vaccines. All right, so why is cold chain so important? So as I've talked about, vaccines are delicate biological substances, and they do become less effective and even destroyed if they're frozen, allowed to get too warm, or exposed to direct sunlight. And that direct sunlight does include ultraviolet light. So your vaccines, because most people have got glass fronted fridges, so just make sure that you always have the vaccines covered. I know, like when it's a busy flu clinic, people often tear the lid open so that you can grab them quickly, but that lid should come back down. Those vaccines shouldn't be exposed to ultraviolet light. And also they shouldn't be sort of like putting kidney dishes ready so they're nice and quick and easy to use. You should grab a vaccine, should be stored in a box, you take the vaccine from that box and then it goes in the patient's arms so that they're as potent as they can be. So the word cold chain is the chain that maintaining the chain from manufacturing to going in the patient's arm. So vaccines have been on a long journey before they even get to you. And so if everyone else has managed to keep them at 2 to 8 degrees, we want to continue doing that. And especially if you're doing outreach clinics as well. So that cold chain should be from the minute it's manufactured until it goes in the patient's arm. That's the ideal. And the part where you guys come in is vaccine delivery. So your responsibility starts once the vaccines arrive at your clinic. And as I said before, all staff, clinical and non-clinical, who receive vaccines should be trained. So for a lot of practices, that will probably include your receptionist. They're probably the points where the vaccines get left. So whatever process you've got in place, make sure they are in place. We've had vaccines up the Cape and Torres left on runways. We've had vaccines put in shelves underneath reception desks. I don't know why, because it's plastered all over it that it's vaccines, but just if you've got a new member of staff, just make sure that everybody knows that your vaccines are very precious and need to go in the vaccine fridge. And then once you're ready to unpack your vaccines, you need to have a good feel of the ice bricks. Make sure that they are still frozen, a little bit sloshy, but still frozen. If they're completely melted, then you need to let QIP know. And then also, you should all be familiar with the cold chain markers. So the freeze one should be clear. If it's purple, that means it's been exposed to freezing temperatures. And then your bullseye, you do not use your vaccines if the bullseye is darker, if the actual eye is darker than the outer circle. So have a quick look at your freeze markers when they arrive, have a feel of your ice bricks. And then once you're happy with that, you can transfer the vaccines into your vaccine fridge. Don't ever just put the whole esky in the vaccine fridge. You actually have to take the vaccines out and pop them in the fridge. And then remember to rotate your stock. You're not just putting all the new vaccines at the front. If there is a problem with your vaccine delivery when it arrives, you can call us, but we'll refer you to QIP. So it's QIP who actually deal, but at that point, it's still a QIP issue. So there is a vaccine delivery failure form that's on the Queensland Immunisation Programme website. So you fill that form in, and I think it even has a little picture of the bullseye and the freeze marker, just to give you an idea. You fill that in and send that back, and then QIP will let you know what to do with the vaccines. But we're always able to take calls as well, but we will eventually have to refer you back to QIP. So when your vaccines arrive, they need to be stored in their original boxes. So you can't take any vaccines out of their boxes. Ideally, we like them to be in open weave baskets. Don't crowd your vaccines. So the picture on the right is not how we want vaccines to be stored. I don't know if you can see the basket at the bottom. All the vaccines are just being chucked in there, and on the top shelf, the vaccines are all being pushed against the back wall and the sides. So we weren't too happy when we saw that fridge. I think there was quite a few vaccines open as well. The fridge over on the left-hand side, it is one of the Cairns Hospital fridges because it's got the temperature wheel on top. But the nurse there, she's one of the rural, the remote places, and she keeps her vaccines, very passionate about her looking after her vaccines. And they're all labelled in the basket. And when they're in the baskets, ideally, if you can have them labelled, which I think a lot of you guys do, and try and store them in like your ages as well. So you've got all your 2, 4, and 6, and you're not getting I don't know, a Zostavax on the same shelf as an MMR or anything like that. I mean, it's common sense, but that's how errors happen. And we do come across fridges sometimes where different age groups are all mixed in and private vaccines mixed up sometimes with funded vaccines. Really helps you, makes it a lot more streamlined and quicker if you can have them all on different shelves. Keep them away from the back panel and the sides. Keep your door opening to an absolute minimum. if your fridge is starting to alarm while you're doing your restocking, close your fridge, put the lid back on the esky, wait a few minutes, let your fridge come back down and then start again. Can be a bit of a lengthy process, but you don't want to cause a cold chain breach by actually putting your vaccines back in the fridge, and rotate your stock. So make sure your oldest stock is to the front. We've had somewhere recently where they had an awful lot of vaccines that were expired and very long expiry date on them. So I don't know how long they've been sat at the back of the fridge. So do rotate your stock. And we've got little labels that we can email you to if you want to laminate them and put the labels. We've got little pictures of all the vaccine boxes if you want to do that with your fridge. And if you have a solid door, we've got magnets as well, and they recommend that you do like a bit of a map on your door so you know which shelf each vaccine's on to make it quicker rather than standing there with the door open. Oh, and there's a picture of baskets there. So the Strive for 5 book is called Strive for 5 because we strive for 5. That's the ideal temperature for vaccines to be stored, but we don't want them to go above 8 degrees and we don't want them to go below 2 degrees. And that's why we ask you to do twice daily minimum maximum temperatures. So the new Strive for 5 temperature charts also ask that you do current temperature as well. And these really need to be manually recorded every morning. Don't just rely that your data logger's ticking away monitoring your temperatures, or rely on the fact that your fridge will alarm if it'll go between above 2 or below 2 or above 8. It's part of your responsibility at the start of a clinic when you're going to be putting vaccines in your patient's arms. You need to have done that manual min-max temperature and know that the fridge since the last time you were in the clinic has been absolutely fine. And also, it's then you need, if there has been a cold chain breach, you need to act quickly. If your clinic is closed, but some clinics are only open a few times a week, not open every day, ideally just put a line when the clinic's closed so it's easier on the temperature chart to know that it doesn't look like you've missed massive gaps in your temperature monitoring. And this is the Queensland Health temperature chart. So ideally, you do your minimum maximum. The little crosses that we've put between the min and max are the current temperature, just because the Strive for 5 is asking for current temperatures. So we've kind of just devised putting the current temperature like a little cross and then the min max with the dots. And we've written when the clinic is closed. And then on the 13th of February, the fridge got to 10 degrees. So what we'd like you to do is on the back page, just write fridge got to 10 degrees because we were restocking, door closed, everything back to normal. So it just helps if somebody else comes back to check the fridge, you've already can see, oh yeah, the temperature was because they left the door open or something. Whereas if someone comes back and sees 10 degrees ago, which we get a lot, so oh, there's been a cold chain breach and they don't know why, and then it's all phoned through and it turns into a big cold chain breach, when really it was just because somebody didn't reset the fridge and document on the back page what happened. So it's really important if everyone, especially in big teams of nurses, it's not so bad when it's a one nurse clinic. And then this one is what the, oh, that's the back page. Sorry, that I was just showing that's what we write on the back page. I can see two slides come up at once. That's why I was getting confused. And this is what the Strive for 5 document looks like. We don't mind you using either. Brisbane have said you can either use their Queensland Health min-max charts or you can use a Strive for 5. The main thing is that you're doing your min-max twice a day. And with this chart, you can actually write the temperatures at the top and bottom and the current. And then we still recommend doing the little dots as well, because it gives you an idea. Then you can see if your fridge is tracking at a higher temperature or low, or when you get in peaks. And just for example, we did a temperature of 13 something up there, and it's not that clear, but that on the back page we wrote that it was reported as a cold chain breach, spoke to TPHU, and this is the advice that they gave. So even if it's a full cold chain breach, try and write it on the back page, because it's good for auditing purposes for you guys as well, if you have to go back over and if ever there's been an error with your fridge and we need to sort of check if there's ever been any breaches. So please try and document on those back pages. Data loggers come in all sorts of different styles and shapes, and I'm not familiar with a lot of them because I've only ever worked with one brand, but I know when I speak to you guys on the phone, we speak to you about all different types of data loggers. Data loggers should continuously monitor your fridge and be set at 5-minute intervals. So don't do it any more frequent than that, because it's just sets a lot of data if you're doing it more frequent than that. So try and keep it at 5-minute intervals. And your data logger should be downloaded weekly. So try and have a set day where you do your data download, and you don't just do your data download and go, yeah, it's done. You have to go through the data and check that there hasn't been any breaches that you weren't aware of. And you also should check it with your fridge temperature to make sure you're not getting completely different temperatures. And one of the most important things about your data logger is knowing how to use it. So if you've not got the instruction manual with it, you can just go online. I just Googled this one for the Easy Logger. And it's important because we'll ask for a data download when you guys have a cold chain breach. So, and just try and make sure that all the relevant staff know how to use it. It's not just that one person again, which we just find all the time. It's like, oh, sorry, so-and-so is on leave today. So try and have as many people as possible who are involved in vaccine management familiar with it. And the batteries should be changed according to the manufacturer's instructions. And if there are no instructions, we recommend annually. And the data logger should be checked for accuracy as well. So you can either do that using another data logger, or you can ask your technician to do it. A lot of people have the Quirks MediSafe fridge. And with the Quirks MediSafe fridge, it is a little bit different in that Quip ask that you take your twice daily min-max temperatures from the Quirks MediSafe data logger, or whichever data logger you have. There's some history there, I think something to do with some kind of accuracy, but it's the only fridge that they ask to do that. We do have an information sheet. If you have got a Quirks MediSafe fridge and you want a bit more information on that, we can send it to you. A lot of the Quirks MediSafe fridges have what's the cloud called?
The AQ.
The AQ box. So you'd be taking your temperatures from the AQ box. It's not as quick, I don't think, as just doing them in backs, but it's that's what Quip expect if you've got an Avon Quirks fridge, I'm afraid. So, but all of the fridges, your source of truth is your min-max on the front temperature and your data logger's backup. Whereas the Quirks, your source of truth is your data logger, and your digital is your backup. Battery operated thermometers. I think Quip used to supply one when you became a vaccine service provider, but they don't anymore. You're expected to purchase your own. They're essential for power outages and fridge malfunctions and outreach clinics if you do outreach clinics. And these, same as everything else, they require annual checks to ensure their accuracy, and a battery change every 6 to 12 months. And ideally put a little sticker on the back when you've changed them so that you know how often they've been changed. And then in Striver 5, there's that slush test. It tells you how to do the slush test. That's how you do the accuracy. So everyone should be familiar with that. But if you're not, that's at the back of the Striver. It's in the Striver 5, and all min-max thermometers should be checked annually. And this is the ICS Pacific one. But these are really good. These come with like their own little glycol gel, or you can put the probe in a box. So I think they are a bit more expensive than some of them, but they're particularly good for vaccines. So just make sure that you've got plenty of those. You do need enough for each SG, and they're handy for cold chain breaches for your vaccine fridge. I think I'll mention those again soon. All right, cold chain breaches. The bane of your lives probably, because they really hold up your service when you get them. So all temperatures recorded below 2 or above 8 must be reported to Quip via the cold chain breach reporting form now. So Quip, no, that phone number is not in use. I think there's a recorded message that tells you to email Quip. So we can't speak to Quip anymore. It's just on the email, and then they send that through to us, and then it's us that you speak to. But if you do get temperature deviations and excursions that reach a maximum of up to 12 degrees for 15 minutes or less, then that's okay. And that's usually only because of stock taking or cleaning your fridge. So if it happens for any other reason, we need to know about it. And so your fridge got to 11 degrees, but it was 11 degrees for half an hour, like well over the 15-minute mark, that is a cold chain breach. So, and same as if it got to 13 degrees for just 5 minutes, it's gone over that 12-degree mark. It is a cold chain breach. If ever you're unsure, just ring us and we're happy to go through what. But generally, unless it's that 15 minutes below 12 degrees, everything else is considered a cold chain breach. And the main thing is that you then follow your procedures, which should be in your vaccine management protocol. And we see, this is only a tiny bit of what we see, but there's heaps of different reasons why people have cold chain breaches, but the vast majority is power outages, especially if you live in Yorkeys North. Is there anyone from Yorkeys North? Oh dear. There's something wrong with those power lines. Oh, really?
Yeah.
Don't believe them. Fridge malfunctions, door left open, vaccines left out, vaccines not stored in their original boxes. That's a breach as well. Or sometimes the cooler's not being packed correctly. So and there's heaps more reasons, but they're just kind of like the main ones. And we're coming into cyclone season, so you need to make sure you've got all your processes in place. Managing a power outage, keep banging on about it, but your vaccine management protocol, so important. Please follow it. Make sure everyone knows what's written there. And there is a section in the Strive for 5 that's called the checklist for managing power failure, but it pretty much is replicated in the vaccine management protocol. So make sure everyone's on board and knows what to do. The first thing, most important thing, is that nobody uses the vaccines. So try and have like a poster ready to go, like something like that, where it's laminated and it's kept by your fridge. So the minute there's a cold chain breach, whack that on the fridge door and make sure everyone in the clinic knows not to use the vaccines. And then, so inform your staff and then investigate the cold chain breach. Phone ergon, as usual. And then it might be that, you know, it's going to be out for a long time, or you might find that it's just, you don't know why there's a power outage, or if you're in a group of shops, it might just be local to those shops. But try and investigate why there's a power outage to begin with, because you don't want to be running around like crazy and then just find out that power's going to be back on in 2 minutes. It was just an electrician turned it off to do a bit of work locally. You can put your battery, if you don't have power, you can put your battery operated thermometer into the purpose-built vaccine fridge, but you need to do it really quickly because we like to keep the door open into an absolute minimum. And then if it looks like the power is going to be out for a while, or you just don't know what's happening, start thinking about your coolers, start preparing things, getting them ready, have everything out and ready to go. But be prepared, but you don't necessarily have to transfer your vaccines straight away. And you might not even end up transferring your vaccines, but at least if you've got everything there and you're good to go, you're prepared. And if you get to just put them back in the store cupboard, then that's fine. But being prepared is important. The other thing that I can't emphasize enough is that your vaccines are safest left in your fridge until you're fully prepared. We speak to a lot of practices that have had cold chain breaches where the vaccine fridge might be sitting at 11, so they panic and run around like mad and throw everything in an esky, and the esky is at 18 degrees. And then the power comes back on and the fridge didn't even reach 12 degrees, but you've caused your vaccines to get to 18 degrees. Or you've not conditioned your ice bricks and you've chucked that many ice bricks in there that quick and done it all that quickly that your temperature's gone down to 0, and then we have to discard all those vaccines and your fridge is still sat at 11 degrees or whatever. So just don't stress too much, because it is a stressful situation. But just take your time, start thinking about getting things prepared, but don't move those vaccines until you know the temperature in that esky is at 8 degrees or below. Your manufacturer should be able to tell you how long your fridge will stay under 8 degrees, but it's probably not even 20 minutes, especially for the glass door ones. And if your power's gone out, you've not got aircon as well. If you can't access your built-in min-max thermometer or data logger during a breach, this is where that battery operated thermometer comes in handy. So you can sneak that into the fridge, make sure it's sat in the middle, perhaps already have it in a vaccine box so that you're not messing around pushing it in a vaccine box and keeping the door open in a breach. But if you don't have the thermometer handy, just leave the fridge closed, just wait, because once the power comes back on, you can do your min-max. you can do your data download and you'll know exactly what the maximum temperature of that fridge got to. It's only if you're able to do that quickly and early on in the game that you can do that. But otherwise, you're going to find out the temperature once your fridge comes back on anyway. And then just keep that door to a close, keep the opening to an absolute minimum. So hopefully you've all got this equipment. You should have your coolers, and you need to have enough coolers for the amount of vaccines that you've got. And everyone's got big fridges and a lot of vaccines, and we're constantly adding more vaccines to the schedule. So really just like we're coming into cyclone season, so have a look around when you get back to your clinics on Monday, tomorrow or Monday or whenever, and just make sure that you do have enough for the amount of vaccines. I think it's easy to underestimate it because that does happen as well. We have people say, yeah, I packed 3 eskies, but we decided to leave all the flus in the fridge because we didn't think they was as important as the rest of the vaccines. And so just make sure that you do have enough eskies. And then if you have got eskies, you then need to make sure you've got enough ice bricks for all the eskies that you've got. And you need to make sure your freezer holds the amount of ice bricks that you need. And you should have a thermometer for each esky as well, because that's another one that often happens. We don't have thermometers. People don't always have enough thermometers. And you need enough bubble wrap as well, because they do need to be nicely insulated with bubble wrap. Your vaccines do before you put the ice on them. And just make sure everybody knows where they're stored. I think someone clinic I went to a few years ago, everything was stored in the loft. And when the power goes out and it's completely pitch black, you don't want to be wandering around up in a loft. So that's important. So you've had your cold chain breach, you know it's happening. Get all your equipment out, start preparing, and then we'll wait and keep an eye on your fridge, and then we won't move the vaccines until we know that they're below 8 degrees. And you should all know about conditioning ice bricks. So ice bricks, when they first come out the freezer, they can be as low as minus 18 degrees. So you don't want to be chucking a load of ice bricks in there with minimal bubble wrap and putting your vaccines, because you're going to freeze those vaccines. So it can take up to 45 minutes to condition ice brick, which is a very long time. Obviously, we live in the tropics, so they might condition a little bit sooner. So you can put them out in the sun and you can rinse them under cold water. And you want them to be a bit like sweaty and slushy, and you don't want them to be rock solid. You need to just be a little bit sloshy before you use them. Not too slushy, else they're not cold then. Some of the frozen ones you can actually just stick in your esky straight away so that they're cooling the esky down. But the ones that are going to be with the vaccines do need to be conditioned and do need to be a little bit sloshy. So this photograph is taken from Striper 5. So a lot of people photocopy this, print it off and laminate it and put it on their eskies, because it's quite a good visual. If you're with people who aren't familiar with packing eskies, it can visuals are always good when you're a little bit stressed under cold chain breach circumstances. The first photograph is showing you chilling your esky. So the minute the power's gone out and you're trying to work out what to do, just throw a few frozen ice bricks into your esky so you're starting to chill your eskies, because your eskies, they'll be warm. You know, if your clinic's well over 25 degrees, your eskies are going to be that heat as well. And while they're chilling your esky, then your other ice bricks, you want to be conditioning them and making sure that they're nice and sloshy. Put them out in the sun for a while, or rinse them under some warm water. And you're leaving your vaccines in the fridge. You know, they're safe in the fridge. Even if the fridge is slowly creeping up in temperature, keep them there until this is ready. When your vaccines are ready to be transferred, you actually take those frozen ice bricks out, and then you line the esky with bubble wrap, or you can use polystyrene chips. But you want to make like a nice nest in the bottom of the esky so that the vaccines have got some insulation, because it does get quite warm at the bottom of the eskies, especially if they're kept on a warm floor. And then you pack the vaccines. If you can, try and remember which vaccines are in which esky, because if you've got 3 different eskies and they're all at different temperatures, when we start asking you questions about, oh, the hexas, did the hexas get to above 12 degrees, or which esky were they stored in? And then if you say, I don't know which vaccines were stored in which esky, then we generally have to go with the highest temperature of whichever. If you had all 3, you might have had 2 eskies stored at 8 degrees, but one of them went up to 15 degrees. If you don't know which vaccines were in which esky, then we'd have to go with the highest temperature, I'm afraid. And a really good way of doing it is to use printer. Well, your printer might not be working at that time if you've got no power. I don't think I've brought it with me, but the vaccine order forms, you can use those. You can to quickly write which ones are in which esky, if that helps. We do get a lot of scribbles during cold chain breaches because I think a lot of people are frantically writing down which vaccines are where. And then I don't know if you've all picked up a logbook, but the logbooks are really handy for doing. You can write which esky 1, you do your temperatures, esky 3. So documentation is really important for us because we've got to work out which vaccines we're going to allow you to use and which ones we're going to discard. So once your vaccines are all in your esky, then you need your min-max thermometer, which is, we can't all see it, but hopefully everyone's got plenty of these min-max thermometers. And ideally, if you put it inside an empty vaccine for the probe in an empty vaccine box, and try and have that in the middle of all the vaccines. We can do some demonstrations at the end if people want to get involved as well. We've got empty vaccine boxes and ice bricks. So make sure that that's in the middle of all your vaccines. And then you want to nicely cover all your vaccines with plenty more bubble wrap again, so that they're nicely insulated. And then the ice bricks actually go on top. So you don't have ice bricks sat at the bottom of your esky. Once you've chilled your esky and you've lined it, your vaccines go on top of that bubble wrap. And then your ice bricks sit on top of your vaccines, on top of the bubble wrap. And you can put them down the sides as well, depending on the size of the esky. If you only got a few vaccines in a little esky, you probably wouldn't do that because that esky would be nicely cold. But bigger eskies, you'll be putting ice bricks around the outside as well. And then close that door. Keep your thermometer on the outside. And for the first 2 hours, you should be checking it every 15 minutes, and then you should be checking it hourly. And if you find that your vaccines are getting too cold, you pull some ice bricks out. If you find that your vaccine's still not cool enough, you can put more ice bricks in there. So it's great if there's a couple of people doing it, but if you're on your own, it's takes a bit more time. And ideally, as you're transferring the vaccines from the fridge, just clock what time it is, because when you look back on your data logger, say you were transferring the vaccines at 5 to 7, when you look back on your data logger, or when you may have a min-max in there, you can see, you want to be able to go, actually, the vaccine fridge got up to 15 while we were transferring them. So you need to know the temperature of the vaccine fridge while you're transferring, and then you need to know the temperature of the esky once the vaccines are being transferred into the esky. So this is with just your standard eskies. I'll show you some photographs of the soft packs in just a second. There's a really good video. I didn't want to show it tonight because I don't seem to have a lot of luck with IT with showing videos. But you know, the Queensland Immunisation Programme website where all your order forms are and all your information for QIP. There's a 4-minute esky packing video made by QIP. So maybe if you have like an in-service and you have a bit of practice at esky packing, just watch this video. The only thing that she doesn't mention is that you should check the fridge, the esky, every 15 minutes for the first 2 hours. She doesn't mention that. She just goes straight to hourly. But Striper 5, it should be every 15 minutes for the first 2 hours. And this is the section in Striper 5 that talks about esky packing. Highlighted just a couple of things, but I've already talked about them. The probe goes in the middle. Yeah, don't let your vaccines touch the ice packs, and monitor every 15 minutes for the first 2 hours. So that's another thing that you could always print off and laminate and keep with the previous that one. You could keep that with your eskies, and then we've also got some esky stickers that we bought as well that you can put on it. It goes through the process of packing and esking. So these are the soft packs that we've that the Primary Health Network have given away to all the practices who've attended, and we first started using them with the school immunisation programme quite a few years ago with the team at Cairns North. And they are so good because they're so much lighter than these things as well, because it's pretty backbreaking when you've got heavy eskies. And they see the cardboard box, those sheets are, they're the actual ice packs. So they fit in your freezer a lot easier than the bulky ice packs. And they don't have to be conditioned. So the little plastic thing in the bottom left-hand corner is like an insert that goes inside the soft pack. And then those sheets, just you slide them in around the outside, close the lid, and that's it. You're pretty much good to go. It gets down to 5 really quickly, which we were hoping to demonstrate, but ours didn't freeze on time because we put them in the freezer a bit too late. But it does make life so much easier, and they're quite spacious as well, and you don't have to use all the packing material. So it's great that the PHN are giving each practice one of those. And I don't know what size you guys are getting, but you can get small ones, medium-sized ones, big ones. And when we do the school program, they maintain their temperature beautifully. And also they're collapsible as well. So you can flatten them and store them a lot easier, because they're a nightmare to find spaces to store. And if you're a big clinic with a double vaccine fridge, you'll need a lot of eskies. So so that's those. We will do a little, we'll do it at the end when we've finished. We'll probably just pop them on the table here, and we'll just show you what the ice sheets look like, and come around and have a look and have a go at packing them. I already mentioned earlier documentation, but when you've got a cold chain breach, we really need a timeline of events. So after you've contacted QIP, you usually hear from us quite soon afterwards. Just whatever you've done, whether you've left your vaccines in the fridge or they've been transferred into an esky, the aim is to try and keep them between 2 and 8 degrees. And don't ever discard any vaccines without us, even if you know they've all been frozen solid. Please don't discard, because some vaccines do actually survive freezing. And or if you know that, like, people before said, oh, it was in a cold chain breach before, so we knew they were for discard, so we discarded them. That's just not the case anymore. We have our cumulative data now, so we're saving a lot more vaccines than we used to. But we do need to know brand specifics. Certain brands have certain temperatures they can get to, whereas others don't. So that timeline of events just makes it so much easier when we're getting back to you. And as I said before, try and document which vaccines are stored in which cooler, and yeah, with the time, try and keep an idea of time so we can go back over the events. Then you probably all know this, but when you call us, we will request a list of vaccines. It is easy to use your order form. A lot of people just handwrite and scribble, but if you just grab one of your order forms, you can tick each one that you've got, because we actually need to know whether you've got an MMR or a Pyrix or ProQuad or Pyrix Tetra, even though they're all like MMRs or MMRVs, they do have different levels of thermostability information that we have to use to decide whether they can be kept or not. So please don't just say MMRs or DTPs. We actually need to know brand specific, and so use your order form. It just makes it a bit easier for you and clearer for us to read. We will request a copy of your minimum maximum chart, front and back page, with that, ideally with that timeline written on the back. So as things are happening, just keep it on time, do a bit of a documentation. If you're using a logbook, we really need copies of those logbook temperatures to know your esky temperatures, or even if you've written them on scrap pieces of paper, we do need those scanning in and sending to us. And we appreciate that you can't do everything straight away. If you're in a power outage situation, then just keep everything vaccines isolated before you make any decisions on anything. Data download, we always ask for a data download, so please just make sure everybody knows how to do it. And if you don't, Google their information leaflet on how to do the data download. Seem to have had quite a few issues with data downloads just recently. We'll always ask for a copy of your vaccine management protocol, unless we sort of had a breach just last week and we know it's okay. We often ask for a technician's report, or we ask you to have a technician and come and look at your fridge. And that comes from QIP, because we're the people that make the decision as to whether your vaccine fridge is okay to use or not. So if we're not happy, we have to let QIP know, and then we decide whether you can continue to store vaccines in your fridge. So that's why we often ask for the actual copy of the report as well. And you can't use your vaccine. You can't order vaccines again until we're happy with all the requirements. So as soon as a cold chain breach is reported, you kind of you're like automatically suspended, and not because you've done anything wrong, but Quip don't want to be sent. If your order was just about to leave, they will hold it because they need to know that those vaccines have been transferred into a fully functioning vaccine fridge. So if we ask for a lot of information, and sometimes we might ask for more. If it's a long-term breach, so say you're not quite sure what's happening with the power outage, keep monitoring those vaccines closely. But you might need to consider transferring them to another facilities, like some of you may have sister clinics, or you may have a pharmacy nearby. They have to be transferred into another purpose-built vaccination fridge, and they have to be transferred using all the Striver 5 guidelines for monitoring the ESCI as well. And again, if it's been put into a pharmacy next door, we may ask for a copy of their minimum maximum chart as well, because we need to make sure that they are government funded vaccines, and the Queensland Government immunisation programme need to know that their vaccines are being stored correctly. And as I said, never use a domestic fridge or a bar fridge or any other type of a fridge. It's just a purpose-built vaccination fridge, or coolers that are correctly prepared. So we're asking a lot of you all, but at the end of the day, safety comes first. So if it's a cyclone situation, or there's a weather event, or I know the power lines are down, or there could be lots of different scenarios that could happen. Your safety and health comes first, where the vaccines are important, but they're not that important. So don't risk life and limb to save the vaccines. There are lots more at the big in Brisbane that can easily be shipped back up into your fridges once everything's settled back down and back to normal again. So even though I'm sort of banging on about procedures and protocols and looking after your vaccines, your health and safety is definitely the most important thing. All right, so eventually the power comes back on, or your fridge technician has sorted your fridge out. So once the power is back on, if it has been a power outage situation, please record the minimum maximum temperature straight away, and make sure that you document that straight away, because sometimes that's happened and someone else has come along and done it, and then they've said, oh no, the fridge was only got up to 8, and the person who did it straight after the breach hasn't actually documented it, and so it may have got up to 15, but if you've reset it and not documented it, we don't know about that. And that's where your data logger comes in useful as well, because we can go back over the data logger and have a look at that. And we've got that timeline event. We knew that you were transferring your vaccines at 4 o'clock. We can look at the data logger at 4 o'clock and we can say, right, the fridge was at 11 degrees. Your vaccines are actually going to be okay. You just need to mark the boxes or whatever. It's the advice from us. We'll give you that advice and tell you what to do. But don't transfer the vaccines back in your fridge until your fridge is definitely between 2 and 8 degrees. So we don't want to, don't be so hasty like, oh, the power's back on, let's get the vaccines back in the fridge, and then think, oh, actually, the fridge was still sat at 15 degrees. It hadn't got back down to below 8. So please make sure that your fridge is between 2 and 8. So once it is, transfer the vaccines back into the fridge. Don't use them until you've actually got advice from us, and do closely monitor your fridge for a while, because some fridges, if they're a little bit old and the power's been on and off, they can be a bit unstable, and they can then go and have a fridge malfunction because they don't like power surges and power clicking on and off. So just keep an eye on your fridge for a little while. And then once you've had your cold chain breach, we might make some requests before you can actually order your vaccines again. So just occasionally, well, quite frequently actually, we actually ask for an update of your vaccine management protocol. So it really should be checked annually now. I think most people have got the new Striver 5 and the Quip details in their protocols, but just occasionally we find Striver 5 second edition quoted, or the old Quip telephone number. They're the things that we're really looking for. But now that we've got this template that you can all use, everything should be completely up to date. If you're using the template, you've just got to personalise it to your own service with your own staff and brand of fridge and where your emergency equipment's kept. So, and it's, as I said, it's very important that your vaccine management protocol is up to date and that everyone's familiar with it and everyone knows where it's stored. Sometimes if it's been an issue with your fridge, we will ask for 48 hours of fridge monitoring, even though we're allowing you to keep your vaccines there. So there's been a fridge malfunction, but you might not be able to order more vaccines until we've had that 48 hours of temperatures. And then I've already mentioned technician review and a copy of their reports. Appreciate that you might not always be able to get your technician within the sort of first couple of days after a breach, but as I said, QIP won't want to send all those vaccines out to your fridge if they're not happy with how it's functioning. And then we do ask for staff to complete the online education sometimes. I don't know if you've seen it. It's on the Queensland Immunisation website. It's you can do it, I think it takes about an hour. I think it depends how good your knowledge is in the first place. It's module 4. And sometimes if you've had some real doozes where some real silly things were done that perhaps shouldn't have been done, we may ask for the certificates to prove that the education's been done. And it's handy for you guys and your practice managers to know that everyone's done the education, and maybe keep a copy of the certificates with the vaccine management protocol. And then we do site visits as well if there's been some issues, or if you've just requested it, if you've had a cold chain breach that you felt, wasn't particularly handled great, or you just need an update, let us know. We do really like coming out to you guys and doing updates. And I know that you're very busy, and often you have to do it in your lunch break, or you have to stay behind after work sometimes for some updates. So, but we're happy to do it. And it's nice for us to see you all face to face. Maintenance of your fridge should occur anyway, regardless of a breach or not. You should have annual maintenance, and hopefully that's the same for lots of other equipment in your practices, your sterilizer and various other things. So a lot of people tend to do all their maintenance things at the same time of year, and probably part of your accreditation as well for you guys. So please make sure that you get your fridge maintained and checked, but not just your vaccine fridge. You may have a generator. If you do have a generator, make sure it's got fuel in the generator. Make sure it's turned on every now and then, because we have a lot of breaches where the generator didn't kick in and it wasn't working and nobody checked it for a year or something. So especially because we're coming into cyclone season soon, so please make sure that you check your generator. Other equipment, you may have a UPS system. A lot of practices have the uninterrupted power supply. That's the big black box on the far right over there. Fortunately, the practices do have to purchase them at their own expense, but they are very good when you have a power outage. Some of the smaller ones might only last a couple of hours, and some of the larger ones can last up to 7 hours. But they do keep your fridges running. So if you're having frequent power outages and you can manage to get your GP to spend the money, they are very beneficial in avoiding the breaches, because they just kick in the minute the power goes out. They kick in and keep your fridge going. If it's a really long power outage, then you've still got to work out a long-term plan. And also your other equipment as well, like your data loggers, just follow the manufacturer's instructions, but they should be checked as part of your routine fridge equipment as well. Audits, ideally everyone should do an annual audit. It's in the Strive for 5, and it goes through a series of questions. So try and maybe at the same time as you have all your annual maintenance, do an audit at that time, or even now is a good time, pre-cyclone season, go through and just make sure that you're actually up to speed with everything. All right, so I just wanted to mention that a lot of practices give private, that's cold chain. I'm just going to mention a couple of other things and then we'll have a bit of a chat about ITSCs and things. A lot of you have private vaccines, and that's when the GP has done a prescription and the patient turns up with vaccine in a foil bag, and it might have been kept in their fridge at home or kept in their car. And then you often ring us and ask for advice about the cold chain to do with private vaccines. It is actually the GP's responsibility, who is doing the prescription. As they do that prescription, they should be informing the patients that this is a vaccine that's a delicate biological medication that needs to be stored in a vaccine fridge. And ideally, you come straight to the clinic. We get a lot of people who've had vaccines left in cars. And then I think some GPs have ended up paying because the patients have complained, and but not always. The patients sometimes have to buy another vaccine, and we just practice nurses have phoned us saying, oh, we know pharmacists need to be told about this because they're not telling our patients their correct cold chain. But actually, this is a section taken from Striker 5, and it does say that the doctors who are prescribing the prescription should be emphasising about the cold chain and coming straight to the clinic. I just threw that one there at the end of cold chain because I just thought about it, and I know it's a question that comes up a lot, and there's been quite a few vaccines discarded before that are private. So I'll just go through some of the resources that you can find all this information, and then we can do some questions, and then Karen and I will just put the vaccines and we'll talk about esky packing. Queensland Immunisation Programme is our go-to. It's you just Google Queensland Immunisation Programme and this whole web page comes up, and it shows you eligibility criteria, which is quite good. We do get asked a lot of questions. There's a whole section on hepatitis B because we do get asked a lot of questions about that. You can download the schedules from there. Unfortunately, Quip haven't printed off any schedules for a long time. So you do have to download them yourselves. And I know that a lot of you don't have coloured printers. We're hoping that in the new year, when all this meningococcal B comes on, and we've had the shingles vaccine coming in this November, we're really hoping that they're going to print off some new vaccine because they're looking pretty old and faded, the old ones. And when you print off the A4, we know that, it's not, you want a nice clear poster. So hopefully we're going to see some posters come in soon. If you click on the vaccine service provider down the left-hand side, and then it'll come up with order, store and manage vaccines, cold chain breaches, adverse events, catch-up. It's your go-to for everything to do with the Queensland Immunisation Programme on that web page. So please be familiar with that and have easy access to that. And one of the things that it has on there is your adverse event form. And the web page, the bottom section talks about vaccine administration errors. That's only appeared in the last few weeks, and I did mention it earlier. So now if you have a vaccine administration error, it does need to be reported on an adverse event form, and we'll talk to you about it. And it's important for the pharmaceutical companies and the TGA to know vaccine errors, because if say a 6-year-old was given a Zostavax, which is definitely not ideal, and we don't want that to happen, but it's good for the TGA to have had that follow-up to know that a child actually received the Zostavax and these are the side effects that happened or didn't happen. So even though it's not nice when you've done a vaccine error reporting it, it's really good information for the pharmaceutical companies and for the TGA. So please, and then we're happy to discuss them, and we've all made errors, so we're all human. And then on that website as well, there's the 4 modules for the different learning. So vaccine management is the one that we would recommend you all to do, clinical and non-clinical. It's by the Cunningham Centre. So, and then there's 3 other courses as well. There's a vaccine preparation, and I can't see the other 2 because my eyesight's so bad. National Immunisation Programme, and I can't see what the last one is. Anyway, there's 4 modules there, and if you need CPD, it's great for CPD, and it's great for if you've got new nurses that are new to practice nursing and new to vaccination as well. And then part of Quip is the min-max. You can get min-max charts from Quip. You can get those fridge stickers. The vaccine management protocol, just email us and we'll organise you with a copy of that template. Hopefully everyone has our TPHU_CDC_INS@health email address. I would have thought over time all of you have emailed us. I haven't put it on here, but I'm hoping that you all have our email address. Otherwise, just phone Tropical Public Health and we can speak to you that way. The logbooks, we brought logbooks tonight, but you can order those through Quip as well. If you're doing a vaccine order, you can just, as you email it off, just say, oh, could you please send me a couple of logbooks and some more min-max temperature charts. Striker 5, hopefully everyone has a copy of Striker 5. So lots of documents, most of them obtained from Quit, but please call us if ever you want to find them, or we'll keep a stock ourselves we can send. And I just wanted to mention, we're coming into cyclone season, so our next newsletters, or over the next couple of newsletters, will be asking you to all be prepared and have a plan, and there is a checklist that we have there as well, because it can take you by surprise, but safety comes first. Please don't risk life and limb for vaccines. They're very precious, but they're not that precious. That's it.